Welcome back, students. Let us see in this short video on the Viva on the stomach. The further questions may be in relation to the stomach on anterosuperior and the postero-inferior surface of the stomach. So let us see first the anterosuperior surface relations. If we see the relation of the anterosuperior surface near the cardiac end of the stomach and part of the fundus here above this area, it is covered by the left lobe of the liver. Okay, this is covered by the left lobe of the liver, while a large area of the body of the stomach here is also covered by the diaphragm. So this area, large area, including right from the left gastric, lesser curvature to the greater curvature, it is in relation to the diaphragm. Okay, and also through the diaphragm it is in relation to that of the costal margin, while an area which lies below the costal margin, this much area, that is most of the pyloric part, pyloric antrum, pyloric canal and pylorus, these are in relation to the anterior abdominal wall. So this area is in relation to the anterior abdominal wall in the epigastric region while this area this area is in relation to the diaphragm and then to the liver. Now about the postero-inferior surface, that is, which is also known as the stomach bed. So what are the relations of the stomach bed? Let us see here. The stomach, the fundic part of the stomach on its postero-inferior surface is related to the diaphragm. Then near its greater curvature, it is related to the spleen. Near its lesser curvature or in the middle almost, it is in relation to the left kidney and the left suprarenal gland. Then transversely, deep to this, there is the passage of the body of the pancreas as its tail is going towards the spleen. So then after this kidney and suprarenal gland, the kidney and is crossed by the body of the pancreas. Then its relation is close to that in the midline to the abdominal aorta, just below the celiac trunk. Celiac trunk will be somewhere here. Just below it will be there. Okay. Then this, where it is in relation to the pancreas will give attachment to the mesocolon, that is called as transverse mesocolon. So the greater curvature, especially when the stomach is full, may override or may have anterior relation with that of the upper border of the transverse colon also. Okay, otherwise the pyloric part of the stomach will go here and pylorus will go to the right of the median plane. It will go to the right of the median plane. So these are the structures which are in relation to that of the stomach bed, postero-inferior surface, which forms the stomach bed. So these are the relation of the anterosuperior and postero. So you should show by holding the stomach in anatomical position, the relation in anterosuperior and then into the postero-inferior surface. Then the examiner can also ask you what is the arterial supply of the stomach. The major artery which supply to the stomach is the left gastric artery, which is a branch from the celiac trunk. So this comes from the celiac trunk which lies in midline and then it runs along the lesser curvature, left gastric, while the right gastric artery is a branch from the common hepatic artery which runs from the right side to the left side on the lesser curvature, and the right and left gastric arteries, they anastomose at the lesser curvature. Okay, lesser curvature. While the greater curvature is supplied by the right gastroepiploic artery, right, which runs from the right side towards the left side onto the greater curvature in the fold of the greater omentum, and then from the left side, this will be a left gastroepiploic artery, which is a branch from the splenic artery. And the splenic artery will also form the stomach bed because it runs near the upper border of the pancreas, and then it gives the left gastric. Some of the branches from pancreas, that is called as the short gastric artery, will be going to the fundus of the stomach. So which are the major artery? Left gastric and right gastric at the lesser curvature, which is in relation to the lesser omentum. Then the right gastroepiploic, which is a branch from that of the gastroduodenal, and then the left gastroepiploic, which is a branch from that of the splenic artery, and short gastric branches from that of the splenic. This will form the arterial supply of the stomach. Then a further question can come on to the what is the nerve supply of the stomach. Stomach, since it is a viscera organ, it has to be supplied by the autonomic nerves. So the sympathetic and parasympathetic nerve, they supply it. Sympathetic nerve supply, it comes from T6 to the T7 spinal, not T7, T6 to the T10 spinal segment via the greater splenic nerve from thorax, and then it ends into the celiac trunk and the hepatic plexus, and from there the branches of the sympathetic nerve, they innervate the musculature of the stomach, as well as it also innervate the vasomotor, that means tunica media of the blood vessels. So they are responsible for musculature of the stomach, and musculature means mainly they supply to the pylorus or the pyloric sphincter, which they lead to the constriction of the sphincter. They are motor to the pyloric sphincter, but inhibitory to the rest of the muscles of the stomach. Rest of the muscles of the body and the fundus, they are inhibitory, and they are the vasomotor to all those blood vessels which are supplying to that of the stomach. The parasympathetic nerve, it is supplied by the vagal trunks. The left vagal trunk will become the anterior vagal trunk, and at the esophageal opening into the this stomach or at the cardiac end, this trunk will run on the anterior surface, while the left, the posterior vagal trunk. The posterior vagal trunk will run onto the posterior surface of the stomach and will supply to the musculature of the stomach. It will be relaxant to the smooth muscles of the pyloric sphincter, but it will lead to the constriction of the rest of the muscles of the stomach. But most important vagal innervation is to the mucosa of the stomach, where the glands are there, acid secreting glands are there, and which stimulation of the vagal trunk will lead to the excessive stimulation of the acid. So in case of the peptic ulcer, where the stimulation of the vagal trunk is mostly seen, the cutting of the vagus nerve near the esophagus, that means to the anterior vagal trunk and posterior vagal trunk, so that to inhibit the supply to the glands which secrete the acid, may cure the gastric ulcers. It may cure the gastric ulcer. This surgical procedure is called as vagotomy. It is called as vagotomy. So this is the nerve or autonomic innervation, sympathetic and the parasympathetic innervation to that of the stomach. He may ask, what beside this gastric ulcer due to this hyperacidity, what are the other conditions which may be associated with the stomach? The carcinoma of the stomach or the stomach cancer is very common condition. It is also very common condition is there. I think that I must have covered almost all the Viva question in relation to the stomach. Sometime if your stomach in your dissection hall is open also, he may also ask the mucosal folds, longitudinally running mucosal folds, which are called as the rugoes. Okay, and this mucosal fold, they are more concentrated towards the lesser curvature. Okay, and forms the cardiac canal. Okay, these are the and one can also see the beside this gastric rugae, one can also see with the hand lens the gastric pit. Thank you very much for watching this video on the Viva on the stomach.